answer them. And then I am excited to introduce our next presenter, Mr. Todd Nutbrown with the City of Largo's Homeless Street Outreach Team. Todd can tell you a little bit more about it, but the Largo's Street Outreach Team, as you may have heard me say earlier, has actually received some national recognition recently for innovations in outreach. So I am really excited for y'all to hear from Mr. Todd Nutbrown. Todd?
Good afternoon. Hello, everyone, or good evening, I guess. Sorry. It's been one of those days, so I apologize. Can everybody hear me okay?
Yes.
Okay, wonderful. Good evening. I wish you didn't put me after Lieutenant Haish, but we'll try to keep up with the trend here. Uh, Once again, my name is Todd Nutbrown. I've been doing either running teams for outreach. I worked also with the city of Toronto. I ran their whole system. Basically, we have 119 shelters in the city of Toronto. My job was to organize those. And from there, I worked with Toronto Community Housing. And then I came to the States. I was the first one hired to develop the team in Tampa, Florida. Then I went to Texas and started their team in San Antonio. And then I was lucky enough and fortunate enough to be offered a job with the city of Largo, which I feel very blessed. Um, I think the first thing that I would say is any outreach worker, it's energy. You can have all these systems and policies and ideals. If you're not out there with the energy, folks are already struggling. Your job is to go out there and inspire, to convince, to develop those bonds and relationships. So that's my responsibility. First thing is to try to break down those barriers. I'm not a small fellow, so I sometimes have to, try to convince people that I'm there for them and that I'm not another officer. I kind of have that look. So that's kind of my first thing is that first impression. I always call it planned and strategic connectivity. We have to do it in a strategic way. One, to build those relationships and bonds. Two, it's definitely to be able to understand the system, how to navigate that. That's basically what I am, is a navigation. I think any other outreach worker would say that. Sometimes you get into case management depending on the complexities, but my job is basically to know the programs and services in Pinellas County and to assess the individual for suitability. But I only do that with a strength-based approach. I don't always look at the barriers. I look at what this person is good at, what they're going to excel at, and build on that to build up their self-esteem. So I think I can bring people along pretty quick because they see that I'm trying to build them up, not just designate them to somewhere. I'm also looking at efficiencies there. I'm going to start because I'm new to the city for about a year and a half, and kind of the steps that we've put into place for me coming in as the only homeless outreach specialist for the city of Largo. I work with housing under Arrow, Woodard, but I'm also under Sergeant Dulski and the police department. I'm actually housed in the police department. So I have a unique perspective. I was a federal correctional officer years ago, so I kind of have a little bit of understanding of what, policing looks like in that sort of realm. But I was more angled at the social work side, so that's kind of why I went in the direction I did. You really have to understand the city you're in. Everybody's the same across North America. I don't care what city, what place you go to. People, humans are humans, but there are idiosyncrasies in every area. A great example would be the nomadic nature of the homeless population or unhoused population in Pinellas County. They could be in St. Pete in the afternoon, and by the evening they could be in Largo. So people are very motion. Everybody's in motion. So you have to take that into context of how we serve these folks. You try to serve the folks, I'm responsible for Largo, but at times, you have to think outside the box. There's definitely a gray area in trying to support some of these folks that maybe would have been in Pinellas Park, but are now unhoused in our city and that sort of thing. Um, and the other part was, we always, officers have a certain job. And once you understand that, you understand, okay, this is where the barriers are to the housing piece or the social work piece. So what I bring with the team is kind of conceptualized ideology, thought process for best practice. I've worked everywhere, and I'm 1,000 years old. So some of these things that you see work over and over and over again, that's just not a hypothesis. That's active learning or learning on the fly. So what we've done with the police department is we've done sessions with each officer in groups to kind of and I'm very blessed because Sergeant Dulski, if anybody knows him, he's a very compassionate person. You know, he still does the policing part, 27 years, but he also has a real heart for the unhoused population. So, you know, he brought along, and he and I have got to educate the rest of the police department. Now, you see that in that slide that Officer Melandro, he's the officer in charge of the outreach. He's out there working every day, sending me referrals. And also Officer Stamper. Those two gentlemen help me kind of, they're my fingers out there. What we have to remember about officers is they're out 90% of the time, and there's a heck of a lot more of them than there is of me. So they're a great tool to bring people to me that I can access and try to, convince and do that work to get people where they need to go in the services in the community. So, when you talk about community partners and people that are there, the first community partner I had are the people around me. I got to make sure that our group is efficient, that we're all on the same page, that they actually see that what I do can make their job, enhance their job and what they do, and make their job easier. That's what I'm there for. I'm there to, instead of them having to trespass a person 85 times in front of numerous, properties and that sort of thing, businesses and private. I'm there to kind of give them those options and build them up so they'll take an option outside of that. So, we do have a big component in the city of Largo that, feedings, those things are there. But what we want to do is actually lift people up and actually want to go to a program where they can get back on their feet and not just, look for the next meal, but actually thrive. I want to see people thrive and get to there. So that, we have that dichotomy. We're always working in that, try and work together. Um, One of the biggest things for me was understanding what is the history in this area of the unhoused population and what programs and services. I work with the HLA in Texas. I've worked at HLA in Hillsborough. It was called Sarah in Texas. So I got a good feel for what these lovely folks do and what their mandate and what they're trying to do. And I try to make my work in conjunction with what they do. Sometimes, we have to react quickly and we have to be creative. So what we've really developed is we have a list of all the community programs and services. And I'm better to explain what we do in an example. Here's a great example the other day. We have an individual who doesn't want to be trespassed anymore, finally says, I'm ready to move on. What can you do for me? Well, I meet him in the road. I look him up on HMIS, which is the database system, and I see, wow, this guy's been everywhere. This guy's been for 12 years bouncing around our system. So what I start to do is look, okay, housing isn't the biggest barrier here. What is the barrier for this individual to be successful? So as we get into more conversation, they get to know me, and maybe it might take two touches, but hopefully one touch. That's what we call, a lot of folks call in outreach work, touches with people, to make contact and get to know them, and then for them to get to know you. Um, what we found was this individual definitely had an addiction issue that, it was a secret. He liked to keep it quiet. It was obvious in the way he was living and some of the, the nonverbals and things that were going on. So we looked at the complexity of that, and I said, okay, well, we have to work on on this addiction. Are you ready to face this? And they were like, yeah, I think so. I said, well, you call me back tomorrow and let me know if you're really ready. You can go to Safe Harbor right now. It'll get you off the street. The officers won't bother you. And then give me a call tomorrow and we'll work on that. So that individual went to Safe Harbor. They called me the next day and said, yeah, I'm ready. So I went and picked them up and drove them to Operation PAR, which is a medically assisted rehab and detox here in the area. Took them over to the facility. And the other part I'm going to bring in here that's very important with outreach workers is developing the bonds and relationships with the service providers. Instead of calling on a regular number, I actually bypass that and get to know the folks that are behind the scenes that we can get access to. Sat with the individual. We did the over the phone interview, screening, sorry. Then transported them over to the facility, which I got lucky. It was that day they could take him. Got him in there. Um, so he was there for 7 to 10 days. He graduated from that program. I worked with our case manager. So here's the case management side. We're not supposed to case management, but you get into it. And then made sure I went to pick them up, transported them to another program in the area called HEP, the Homeless Empowerment Program, where we have 20 beds. The city of Largo, we purchased 20 beds, 4 female and 16 male, and transported them over. I didn't let them get over on their own because they might have gone and seen their old friends that helped their habit on the street. So I make sure they get there directly. And then once we get there, I help them with the intake with those folks, and then from there they go into that program, and that's a rehousing program. I mean, it's a shelter, but I think a lot of folks here that know me, if they've seen me anywhere, I make sure that I don't refer to anything as a rehousing or as a shelter. I try to change the verbiage and say it's an opportunity and it's a rehousing program. If you work the program with your case manager, you can get rehoused because successes are happening all the time. It's up to you and you can do it, you know. So we get them in there, and this individual, this was probably 2 weeks ago. They have now at HEP they worked on his dental. They have a free dental office there. They worked on this individual's um, uh, aptitudes for work, so his resume, and now he has a job with one of the gas stations in the area. So he's building up that sort of capacity and just small steps, and then all of a sudden he's found some faith, which was great for him. That's what I think what he needed to help him be strong, and then from there he just worked on into hopefully we'll have him rehoused in the next 2 to 3 weeks. They're working on that with the housing navigation now. So that's just an example. And another big important part with Lieutenant Haitian and Safe Harbor is that's a low barrier shelter. So we can get somebody off the street quickly. I don't have to wait for an intake. I don't have to wait. Like you said, homelessness doesn't happen just on the work days. So it helps me get that access to where they can go somewhere where they can get a meal, safety, a little, stability, and then be ready if they need to stay there or if they can transition to another program if that's what works for them. So that's kind of an example of how the system works. We used to, when I was started, it was like, okay, we just need a housing program. All they need is shelter, get them off the street. I think now years of doing this, you look at the complexity of it. Okay, what are real barriers here and how can we get rid of those and move them out of the way and work with the individual so their strengths are being accessed, not just their weaknesses or like you would say, addiction. So I think that's a real big part. The city has really enjoyed that kind of approach. And I think other service providers have too. I would never go to Safe Harbor and just dump someone. I would try to make sure that we have a plan. So that's the kind of the case management without being a case manager, but you kind of roll into it every once in a while. Um, so my job, I last month I had 950 calls, and I had about 170 emails. Or sorry, texts. That was just on my work phone. Then you get emails and stuff from the officers and that sort of thing. So that's the other ones on top of that. We are supporting around 50 folks a month, somewhere around there between 40 and 50 folks a month, trying to access programs and services and getting them into intake. I mean, obviously not everybody shows up for intake, but we give them the opportunity. And we don't give up on that. We'll give them another crack at it. Obviously we're with Safe Harbor. A great bunch out there, always support me really, really well. Pinellas Hope, always a great program, great case management, good management. Just enjoy that access to that program, and that's every Tuesday at 7 a.m. Is their intake. And then we use HEP a lot, the Homeless Empowerment Program, because obviously the city has purchased some beds through there. So that's another access program where we can work them through that program and hopefully get them rehoused. And we're having some really great outcomes in all these programs. The other part is obviously the medical facilities. We do get a lot of calls from folks that are struggling in medical facilities, so we're there to kind of support those folks. If it's a really complex discharge, we try not to do that too much. We try to let the case management at the hospitals do that sort of thing or medical facilities, but we are there for them if there's some complexity and we can help somebody. We also, I'm also, I'm a little bit different. I'm a little bit of I have a lot of street experience. I've worked in a lot of cities where they don't really baby you. They just say, get out there and do it. And so the one thing that I have is I have a radio. So I'm connected to the same dispatch as the officers are. So they know when I'm out of my car, if I'm transporting someone. So it's all time stamped. So they know where I am and they'll do their wellness checks and make sure that I'm okay. So that's a little bit of a different aspect than I would have than maybe some communities. I love that because I like to have that freedom to be creative and meet people where they are. I don't go in the woods deep and by myself, but I have the ability to go anywhere I need to go. And then all of a sudden we have what's the other one here? Sorry. Uh, and also the access to email. It's on our website that folks can get a hold of me. Um, and then obviously we have calls, emails. We have our own email site for the homeless division. So we're all over the place. Um, so if anybody has any information or needs any information or wants to know more about what we do, I mean, obviously you can get a hold of me at homelessoutreach@largo.com. And I will get back to you as soon as possible. And if you have anybody in the community that you see that you feel you're in the Largo area or right around the Largo area and you see someone and you just want to help, you definitely can get a hold of me at any time on that email, and I'll get back to you. The other one thing I want to add, effectiveness in what I do is responding quickly. I don't wait 24, 48 hours. I make sure they know, even if I can't help them at that minute, I got you. I got your information. I'll get back to you as soon as possible. So I don't think anybody feels like I left them for 3 days. And I'm getting great feedback on some of the questionnaires that we send out that, just people want to be heard and felt that somebody's listening, I think is important in our system. And sometimes that can be an area that's left, a little short. So just my 2 cents on that one.
Thank you so much, Todd. That is such awesome information. If people are experiencing homelessness in Largo, just so we can be 100% clear, is the best way to reach you and your team the homelessoutreach@largo.com email?
Yes, I mean that's always. I mean that's constantly. I'm checking that, and other folks. It's connected to a few folks, so just in case I miss it. Um, so yes, I mean that'd be the best way. And I mean if you want, a face to face or to want to chat over the phone, just go in there and I'll get a hold of you and give you the information, or you can give me your number and I'll get a hold of you right away.
Awesome. Thank you so much. That is such amazing information. If you have questions about street outreach in Largo, or if you want to be connected to some resources in Largo, go ahead and drop information in the Q&A box, and we will make sure that Todd here gets that. And of course, we'll still have a little bit of time at the end for more questions. Before we move on to our presenters with